ODI equals oral disposition index. HbA1c may be normal, but other values OD abnormal. HbA1c normal, but low HOMA B with high HOMA have highest risk.
Even if the HbA1c, fasting blood sugar, random blood sugar, postprandial blood sugar are normal, if the waist circumference of any Indian, if it is more than 85 centimeter, they have to remember they are producing large amount of insulin. What happens is, once we cross 85 centimeters of waist circumference is, our liver goes on producing large amount of glucose 24/7, 365 days. Because of the large amount of glucose that is there in the body, the muscle and the adipose fat tissue has to take in all the extra glucose that is getting produced. But the insulin resistance is there, so the muscle and the fat and the liver and the other organs, they refuse to take the glucose inside the tissue. This produces large amount of insulin. This large amount of insulin triggers large amount of triglycerides. Triglycerides trigger obesity, and this is a carbohydrate loop or obesity loop, and they go on increasing abdominal waist circumference. First step that happens is the insulin controls the amount of glucose that is produced by the liver 24/7. Why the liver has to produce glucose 24/7 is, after we take a lunch or dinner, so within 20 to 30 minutes, our glucose will be disposed of to the muscle and the fat tissue and the organs. Rest of the time, the brain needs glucose, and so the glucose has to be produced somewhere. The liver goes on producing glucose. This is controlled by the insulin. In insulin resistance, what happens is, the control of insulin on the hepatic glucose production will be absent, and liver goes on producing large amount of glucose. And all this amount of glucose, in addition to the diet that we take, the glucose will not be taken by the muscle, which takes 60% of the glucose because of the muscular insulin resistance. So every organ has a insulin resistance. So the gates or the energy glucose that has to enter into the muscle will come down. This produces, in the initial stage, even if somebody is obese, HbA1c, fasting blood sugar, random blood sugar may be normal, because you can see in this curve, they have a high insulin production. As long as the pancreatic beta cells produce large amount of insulin, then the HbA1c and blood sugars will be normal, but our insulin sensitivity is gone. First sign to wherever going into diabetes is the beta cell dysfunction. This is made out by insulin glucose index and oral disposition index, which I will tell you later.